March is Colorectal Cancer Awareness Month, and we tonight are taking a closer look at a really troubling trend of young people, often with no family history, who are being diagnosed.
Colorectal cancer has now become the number one cause of cancer-related deaths in men under the age of 50 and number two in women. We know that it can run in families and that having a first-degree relative with colorectal cancer, especially at a young age, significantly increases the risk.
And listen to this, about 11% of all colon cancer diagnoses occur now in people under 50. So symptoms include abdominal pain, changes in bathroom habits, blood in the stool, and unexplained weight loss.
Joining us now in recognition of Colorectal Cancer Awareness Month and National Nutrition Month is Dr. Yousuf Gaffar, an oncologist with AdventHealth Porter. Dr. Gaffar, thank you for being here.
We sure appreciate it.
Yes, thank you for having me.
So as we said, this troubling trend of people under 50 getting this, is it diet? Are they just not paying attention? What's the deal?
So it seems to be a combination of things. I think one of the big contributors is what we're eating. Seems to be related to red meat, processed foods. That's a big one.
Yeah.
And then even processed foods that are smoked, that sort of thing. And that all seems to be affecting our microbiome. In English, as I always say to my patients, that's related to the good bacteria in our gut is being reduced, and the bad bacteria are building up. And all those seem to be increasing the risk of somebody developing colon cancer. And most importantly, it's really important to get screened because a lot of people do not have symptoms. A great majority of people do not have symptoms.
Those are the things we shouldn't be eating. We always hear we should be eating a balanced diet, but what exactly is that? What should we be putting in our mouths?
I always tell my patients there's really three types of foods that we really need to eat more of. Those include cruciferous vegetables such as broccoli, Brussels sprouts, cauliflower, eating green leafy vegetables like kale, spinach, that sort of thing, as well as berries such as blueberries, raspberries, strawberries. All of them have antioxidants, and the leafy vegetables have that fiber you need to maintain good gut health.
So what about supplements? Are there any we should be taking, and who, if there are some out there?
So I tend to think of somebody's age as sort of when I recommend or talk about supplements. So what I say is if you're under the age of 30 or under, you really get all the nutrients you need from your diet. If you're in between your 40s and 50s, that's when your bone health becomes really important. So trying to make sure somebody has enough vitamin D and calcium, as well as having enough omega-3 fatty acids or fish oil in your diet, and fiber. And when we're older, over 65, I tend to think of, hey, we don't get enough vitamin B12. We have to make sure we have enough of that in our diet, and including looking at the vitamin D, calcium, fish oil, that sort of thing.
All right, Dr. Gaffar with AdventHealth Porter Hospital. Thank you so much for talking with us.
Thank you for having me.